Hi everyone, it's Dr. Derek here from AduMed. When it comes to our patients that present to us with erectile dysfunction, I think it's really helpful to split up the different causes into three main groups. So firstly, we have our organic causes. So this will include our cardiovascular disease, smoking and hypertension. Then we can look at our psychological causes. And then lastly, we can think about our drug-induced causes. This includes our medications such as SSRIs, our antihypertensives. I think it's a really good way to approach this topic because our history taking, our examination and our investigations are all geared up towards this. So let's look at all of this in a bit more detail. Starting off with our assessment of these patients, it's really good to take a thorough social history so you're aware of the patient's circumstances in order to divulge if psychosexual causes are the reason for the patient's erectile dysfunction. Now, if the patient has quite sudden onset symptoms, has a low libido, but is still able to stimulate and self-stimulates erections, it's more likely that these causes is due to psychological causes. However, in patients who have a gradual onset of symptoms with a normal libido, in addition to this, they might have reduced tumescence of the penis. These patients are more likely to have the symptoms caused by organic causes. Examination should include a blood pressure, BMI, and assessment of whether there are signs of testosterone deficiency. These signs may include gynecomastia and reduced body hair. NICE guidance also suggests that we consider a genital examination to look for signs of hypogonadism, anatomical abnormalities including of the penis, testicles and the prostate. Blood tests can be also arranged, which will include a HbA1c, lipids and fasting testosterone between 9 and 11 am. Now, a deficiency in this may be due to hypogonadism. Now, if testosterone is low, it should be repeated with an FSH, LH and a prolactin. Other bloods to consider as part of our workup include a PSA, TFTs, LFTs and U's. Lifestyle advice is really important, so we need to give patients advice about weight loss, exercising more, stopping smoking, and also reducing the overall alcohol intake. We may also consider referring onwards to certain specialties, for instance to the endocrinologist if there are concerns about a low testosterone level. We can also consider a urology referral if there are concerns about structural abnormalities. And also we can think about a cardiology referral if the patient has a particularly high cardiovascular risk. When our patients present to us and if they are not at high cardiovascular risk, we can also consider commencing them on our phosphodiesterase inhibitors such as sildenafil and tadalafil. And we just need to review them in 6 to 8 weeks to check on them and see how it is working. Some contraindications to the use of these drugs include patients already on nitrates or similar drugs such as nicorandil. Also, this includes our patients who are hypotensive, and also those who are 6 months or less post a stroke or MI. Side effects of these medications include headaches, flushing, nasal congestion, and blue discoloration of the skin. Now, the way I remember this is simply by the phrase, the blue pill causes blue discoloration. We can then assess the response to treatment at this follow-up appointment at 6 to 8 weeks time. And basically we need to keep in mind that some patients may not have a beneficial response at all, and these patients we need to reassess the course. Particularly patients who have got hypogonadism may not have a very good response to these medications. Now, we've got a few scopes in terms of management, so we can increase the dose to the maximum tolerated dose in order to get an effective use for the patient. And essentially we need to give the patient at least 4 to 8 trials before we move on. Current guidance also suggests that the patient should try at least 2 different of these phosphodiesterase inhibitors before we can agree that there's been treatment failure and we refer onwards. So that brings us to the end of today's video. I find it really helpful to break up our different causes of erectile dysfunction into 3 separate groups. So we talked about our organic causes, our psychogenic causes, and also our medication-induced causes. This is because our history taking, our examination, and our investigation is all geared up towards looking through and divulging these different causes. As always, if you found this video helpful, don't forget to leave a like and subscribe. Also, make sure you check out our urology playlist for a lot more information on other topics within this curriculum area. Until the next time, I'll see you soon.